Hi, Dr. Rehrig here again. Today's topic relates to drugs and medications, meds as we call them. This probably looks familiar to most of you out there. This is what people get their meds in, whether it be from CVS or Walgreens or Rite Aids or Happy Harry's or whatever. This is what the container is. I have been asked, being a practitioner of someone who promotes alternative methods to drugs, what the difference is between a medication and a drug. And I have a distinction because a medication, to me, it even sounds good. Actually, the word medication or medicine comes from the Latin word that means doctor, and also means heal, to heal. So medicine actually is a healing agent. And I'm all for medicine. Actually, I think medicine makes total sense to me. Somebody has a life-threatening illness, they have a bacterial infection of some type. I think an antibiotic would be the perfect solution, and people should be on an antibiotic if they have that kind of problem. That is a med to me, a medicine. Drugs, on the other hand, I have a distinction there. And drugs to me would be things that you're taking because no one's looking to find out why you have the symptom. So people are really taking far more drugs than they are medicines. And so we're kind of like mixing the two. Somebody says, take your meds. Most of the meds you're taking are actually drugs. If you have high blood pressure, you're taking a drug for it, not a medicine, because a blood pressure problem would be actually a symptom of something else, whatever it is. If you have high cholesterol, you're taking a drug, not a med, for cholesterol. Why? Because cholesterol is a symptom of a problem, never located, never found, and never addressed. So I could go on and on. Diabetes, on the other hand, if a person is a diabetic, I hope they take their meds because they would need that to help control the rise in glucose in the bloodstream. And certainly most of the meds they take would relate to helping them with insulin, which controls blood sugar. Back to the drug aspect. I can guarantee you, and I wish I had a statistic on this, because I would estimate, just off the top of my head, probably 75, 80%, maybe higher, of the meds people are taking for all their various aches and pains and problems from headaches to restless leg to fibromyalgia. Those meds are actually drugs because no one has taken the next step. They don't ask the next question, which should be, why? I mean, why do we have this? So at the Rehrig Chiropractic and Wellness Center, we don't really care about symptoms. We do in the sense that they are clues. We need to know about them, and when patients deliver us with all the symptoms that they took their medical doctor and found out they needed to take some kind of a quote-unquote med, we, on the other hand, have methods where we find out why a person has a problem. And it's actually, to me, the hallmark of what we do here at the Rehrig Chiropractic and Wellness Center. I would recommend highly, since we have free consultations, that if you're taking a med, let me backtrack. If you're taking a drug that is masquerading as a med, I would highly recommend you call 610-566-9040 and come in as a free consultation. Let's see if we can get to the actual cause of the problem instead of you just addressing the symptom. Hope to see you soon.